Morning. Earlier today, DESE Commissioner Jeff Riley announced that the mask mandate for K-12 schools here in Massachusetts will not be extended beyond February 28th. This was a decision that his team made after careful consultation with public health officials and our office. In its place, the department issued guidance for school districts for using masks in specific scenarios. The Department of Early Education and Care is also updating its guidance to be in line with DESE's guidance. The guidance is one of many resources that we've made available to our schools over the past 2+ years. Our administration's pulled out every stop to keep kids in classrooms where they can learn safely. We're running vaccine clinics in schools across the state. We established the country's first free K-12 surveillance testing program and recently launched the take-home test program, which is available to every educator and child in Massachusetts. We've put the kids and their educators' safety and kids' education at the forefront of all of our decisions, and the same is true today. We've learned a lot about how safe schools are and how to keep kids in class learning over the course of this pandemic, and we have far more tools available to us to deal with the pandemic than we had back at the beginning. We know young people are at very low risk of getting seriously ill from COVID, and we know that fully vaccinated people are also at extremely low risk of getting seriously ill from COVID. This is, of course, even more pronounced for vaccinated children. All schools now have access to testing resources that were never before imagined, and every school-age kid and their family has had ample opportunity at this point to get vaccinated. Massachusetts actually ranks second in the nation for the highest share of kids fully vaccinated at this point in time. And we know from all of our surveillance testing through our Test and Stay program that school settings are very rarely sources of COVID transmission. And we also know that our kids have had to put up with a lot of disruption, a lot of time alone, and have suffered a real learning loss over the past 2 years. There's no debating those points, no matter where you stand. And from free and convenient testing to highly effective vaccines and breakthrough treatments, everyone now has the tools and the knowledge to stay safe with respect to COVID. These resources have allowed us to lift almost every single COVID restriction or mandate at the state level over the course of the past year and a half. And given the extremely low risk for young people, the widespread availability and the proven effectiveness of vaccines, and the distribution of accurate test protocols and tests, it's time to give our kids a sense of normalcy and lift the mask mandate on a statewide basis for schools. COVID, like many other respiratory diseases that we're familiar with, will be with us for the foreseeable future. Thankfully, the advances in vaccines, treatments, and testing are mitigating the harm that's caused by COVID. Those advances and the hard work of so many parents, educators, and kids here in Massachusetts make it possible to give our kids what they have earned, the familiar, welcoming, nurturing classroom that they're used to. We understand many students will continue to wear masks going forward for a number of reasons, and we fully support those individual decisions, and we would urge everyone in K-12 education to do the same. And we want to help schools make kids who make that decision feel comfortable doing so. From education to public health, our administration will continue to make sure kids are learning safely in the classroom, because that's where they learn best. We're a national leader with respect to kids' vaccination rates. We have some of the most robust testing resources for schools in the country, and we'll continue to bring vaccines to every corner of the state and to every school district that's interested in hosting a clinic, so that every family that wants one knows how to get one and has access to one. And we'll continue to innovate and supply schools with the best possible testing resources. People have made a lot of progress by doing all of the work that they've done over the past 2 years to help kids and those who work with them in schools. And today's announcement's another big step forward to safely manage COVID while we get back to what I would describe as the familiar and normal aspects of school and life. And with that, I will turn it over to Commissioner Riley.
Good morning. Thank you, Governor, Lieutenant Governor, and Secretary Peyser. Today, we are lifting the mask requirement in our schools and making masks optional for all students, teachers, and staff. Masking will be an individual choice in schools across the Commonwealth on February 28th, unless a school district decides to establish a local requirement. During the past 2 years, the impact of COVID on children has caused a strain on their mental health, emotional well-being, and academic success. We are relieved to now be in a place where we can provide young people additional relief from COVID-19 restrictions so they can continue to move towards normalcy in the classroom. This decision was made in consultation with infectious disease physicians, the Massachusetts Department of Public Health, and other medical experts. I would like to thank Secretary Sutters and Commissioner Cook for their continued efforts and work with us here at DESE. We know that vaccinations are the best protection against COVID-19. And Massachusetts has one of the highest vaccination rates of young people in the entire country. We are second in the nation among states with the greatest uptake of vaccines in the 5 to 11-year-old group, and 82% of our 16 to 19-year-olds have received at least one shot. We will continue to encourage vaccination and host clinics at any school that wants to hold one. And our robust testing programs that we provide to public and private schools will remain in place. That includes the new at-home rapid test option we launched earlier this month. School districts no longer need to request a waiver from DESE to remove masks in school buildings. Starting February 28th, they can remove masks regardless of vaccination rates in their buildings. Several schools across the Commonwealth have already lifted mask requirements by attesting that 80% of their students and staff are vaccinated, and they have had success. And we believe that removing the mask requirement will make it easier for students to learn, particularly our young readers and students learning English as a second language. While masking is no longer a statewide requirement, we ask all school leaders and students to make sure they respect all individual choices around mask wearing. Please make sure to create a supportive environment that respects everyone's choice to do what is most appropriate and comfortable for them. Thank you. Yes, so our testing program and our at-home launch programs will continue.
What, if any, measurable triggers is the administration putting in place? Should COVID go the wrong way again to bring back masks in schools? Are there triggers that we measure?
So I don't think we speak in hypotheticals about the future, but what I would say is if we've learned anything about COVID, is we always have to be prepared to be ready, and we will act as necessary depending on what happens in the future. Yes? So we are providing, at-home tests for people to take before, which enables us to cull out any positive cases, and I think was successful after the last winter holiday. We think that'll be an effective measure going forward.
Do you think the teachers will be comfortable with this? Teachers, will they be comfortable?
I think that most teachers will be, but there'll be a wide range of opinions.
Do districts are resistant to this, similar to when you announced the remote learning, it was no longer be a thing? Some parents are telling us, well, they want this, but they're concerned their district won't do it. Will DESE at some point kind of force districts to go this direction, or is it really going to be up to these superintendents and school committees?
Again, it's a hypothetical, so I can't speak to the future, but what I can say is local decision-making has been, a practice in Massachusetts for a long time, and at times the state has had to step in when necessary, but I can't speak to the future of it. The state mask mandate is being lifted, and then what happens next will happen at the local level. So we had, I think, 68 that applied, 42 that have been approved, and 21 that are in process. And we're obviously not going to take any more waivers in due to this announcement.
Will those 21 that are still in process, will those still be processed for the next 3 weeks or
Yeah, I think I'll get you more information on that in the future, if that's okay. So our guidance is around what to do for a variety of factors as far as cases and what to do. Are you talking about like a broader guidance for? Yeah, I mean, I think that's going to be taken up by local boards of health and school committees to make that decision. I don't think there's any discussion of that at this point. I don't think that's something that's been discussed at this point. I can't speak to the future.
What situations would you want masks? You said there's going to be guidance to schools on when to mask, right? I mean, is there going to be individual guidance?
No, the guidance is about like an individual case. You know, if a kid is positive, they need to take a test. If they're positive, they stay home for 5 days, and then they should come back and wear a mask for another 5 days. That kind of guidance.
What certain scenarios, the release says there are certain scenarios where masks are still recommended. I understand on the school bus, we still got to wear.
So that is the most important differential is on school buses, masks are still required per federal order.
Are there any other certain scenarios you would recommend them, or is it just based on what's positive?
You know, our guidance is going to strongly suggest those kids that test positive for COVID follow our protocol, which includes wearing a mask when they come back for additional days.
But athletes won't have to wear them playing football or whatever.
So I want to be very clear about this. The MIAA is not overseen by DESE. We are in constant communication with them, and they will be making some statements, I think, in the future about what's going to happen.
So I understand that the vaccination, in order to schedule to expire on 28, 19, but was there any discussion about anything further?
So I think we've extended it 3 times already since we instituted it, and we always assess the circumstances on the ground. You know, we are really relying on our medical and health experts to help us with these decisions.
Governor, could I ask you a question? There seems to be a lot of agreement about this, and yet Michelle Walensky, the CDC, is saying, hey, Governor, hold back a little bit, it's a little too quick. I mean, did you consider her and what she thinks about it?
Well, you got to remember that the CDC is worrying about 50 states worth of data and information. In Massachusetts, we do have very high vaccination rates among our overall population, very high vaccination rates. Again, I'm speaking relative to other states. Very high vaccination rates for kids who are in school. Most states don't have the kind of surveillance testing program that we have in place. Most states don't have pool testing. Most states don't have take-home tests. We also have one of the lowest hospitalization rates in the country, and we have the lowest positive test rate in the country. So I think to some extent, she's applying what I would describe as a national standard because there are 50 states out there. But within that 50 states, you have a lot of states that are in different places.
Governor, you said in your remarks that you have more tools available in this COVID fight. I was wondering if COVID treatments played into this decision at all, such as the COVID pill, because there are kids around vaccinated who are worried when like they bring it home to their elderly grandmother. I was wondering if you have enough supply of those COVID treatments and that way it would.
Well, there's certainly more treatments now than there were before, and for the first time, there are oral medications available, and that will continue to grow over the course of the next few months as well. But I think for us the biggest issue was we have very high vaccination rates, we have very high testing infrastructure in place, and we do a lot of surveillance work, and schools have been proven to be very safe over the course of the pandemic.
Are we at the endemic stage now? Are we just, I mean, is it over? I've asked you this for 2 years. I mean, is it over?
And I've given you the same answer, which is, my Halloween movie analogy, which is, Michael Myers, you just never know. But I think what I will say is I think we've tried over the course of the past couple of years to take seriously the fact that this is going to be something we'll be dealing with for an extended period of time, and that's part of the reason why we bought so many tests, and part of the reason why we continue to distribute masks and built a pretty aggressive testing protocol into our K-12 system in the first place.
So it's like the flu. I mean, we just got to move forward
I think I wouldn't compare it to the flu, but directly, because there are differences between COVID and the flu. But I would say that I think it's going to be important for all of us to understand that this is something we need to figure out how to incorporate into the way we live. Yeah.
Earlier for your commissioner, are there specific metrics that you all are looking at, whether that's hospitalizations, case counts, or to each other, or what have you, to monitor in case mask requirement needs to be reinstituted, or any other measures or applications like this?
I don't want to get into hypotheticals on this. What I can tell you is that we meet on a regular basis with a group of infectious disease experts, and so does DESE. And we're constantly talking to them about the latest updates in information and guidance. And this thing, keep in mind, right, the other thing that's going to change over the course of the next several months, to get back to Abby's point, we are going to have a lot more therapeutics available that will be much easier to use. I just think there's a lot of pieces to this, and you can't just focus on any one of them, which is one of the reasons why we spend a lot of time talking to people who are in the field and in the space and why they do. And then we make decisions based on the guidance we get from them.
So last question, are there any other state mask mandates in place for congregate care settings, for example, and how do you consider?
Say again?
Do you feel that state should mask mandates in certain settings like congregate care? Are you considering this there, or does it remain in place?
Well, part of what we've been saying for a while now is that our primary focus, both around shots and vaccinations and mandates and masks and all the rest, have really been focused on areas that involve vulnerable populations. So healthcare, long-term care, assisted living, homeless shelters, residential programs for people with developmental disabilities and mental health issues, addiction treatment programs. And I think that's going to continue to be where our focus is with those populations that, generally speaking, based on all the data that is out there, are considered to be the most at risk. Pardon me? I think it's most, but you should answer that.
Approximately 85%.
So the rest of state government is open, okay? Registry offices are open. Administrative buildings are open. People are conducting business in state office buildings around the Commonwealth. We think the State House should be open. Yeah, the call, it's their building, it's their call, yeah. Pardon me? No, I don't. I can't hear you, Tiffany, over the... The siren's got to get by. Well, we said since the beginning of this pandemic that we're going to do the best we can to establish what we consider to be statewide frameworks. And if communities want to go beyond what we do, that's their call. And I happen to think that policy, generally speaking, has served the Commonwealth and the Commonwealth cities and towns well over the course of the past 2.5 years. It means we spend a lot of time talking to each other about what's going on the ground in communities around Massachusetts, and it does give us what some people would call patchwork. I would argue that what you get is specificity, and I think that's important to give communities the ability to make the decision they think makes the most sense for them. The reason we're taking the mask mandate off, however, is we do believe between our testing infrastructure, our vaccination programs, our data, and the guidance we've gotten from a lot of folks we talked to in the public health community, that there is a consequence at this point to keeping kids in masks, and we believe we should move beyond that. Thanks. Well, first of all, I think there's maybe 8 days of school left before school vacation. We're practically to school vacation. Cities and towns do have to make decisions, right, around, we try not to, I think when DESE's issued this guidance each time when they've had a date, they've tried to do it a couple of weeks out, because that then gives communities an opportunity to make the decisions that they need to make to respond to whatever it is the state's up to. In this particular case, the current mandate expires when kids come back from vacation. We felt saying something now gives local communities the ability to incorporate whatever they might want to incorporate into their own decision-making before the kids go away for school vacation. Okay.